Schizophrenia classification and diagnosis. Describe and evaluate the classification and diagnosis of schizophrenia, 16 marks. Schizophrenia is a psychotic disorder whereby individuals fail to distinguish between reality and fantasy. There are a number of symptoms characterized with schizophrenia that can be grouped into positive and negative symptoms. Positive symptoms are additional behaviors and experiences which would not normally exist, whereas negative symptoms represent a withdrawal or lack of function that you would usually expect to see in a healthy person. Positive symptoms. Hallucinations. Hallucinations are sensory experiences that have no basis in reality or distorted perceptions of real things. They're experienced in relation to any sense, so for example, hearing voices or seeing people that aren't there. Another positive symptom is delusions. These are beliefs that have no basis in reality, so they make a person with schizophrenia behave in ways that would make sense only to them but are bizarre to others. So for example, believing that you're the victim of a conspiracy, or if you think that you're Jesus. Negative symptoms. One negative symptom is avolition. This is where severe loss of motivation to carry out everyday activities, for example, work, hobbies, personal care. This results in lowered activity levels and unwillingness to carry out goal-directed behaviours. Another negative symptom is speech poverty. This is a reduction in the amount and quality of speech. It may include a delay in verbal responses during conversation. The DSM emphasizes speech disorganization and incoherence. Classification of schizophrenia. There are two main classification systems used to diagnose mental disorders. There's the ICD-10, which is mostly used in the UK and also other parts of the world, and then the DSM-V, also DSM-5, which is mostly used in the USA. The two manuals do differ slightly in the way they diagnose schizophrenia. For example, the DSM require at least one of the main positive symptoms to be present for diagnosis, where two or more negative symptoms is sufficient under the ICD. A3. So there are reliability issues in the diagnosis. Evidence which highlights reliability issues in diagnosis of schizophrenia comes from Copeland et al. Researchers found that there is a low reliability in the agreement between different countries in the diagnosis. When psychiatrists in the US and England were given the same description of a patient, 69% of the US psychiatrists diagnosed schizophrenia, whereas only 2% of the English psychiatrists gave that diagnosis. These findings suggest that there are problems of using the criteria in other cultural settings, so they're not applicable. And this also reinforces the issue of inter-rater reliability by using different manuals to diagnose schizophrenia. Further low support of low reliability. One limitation of a diagnosis of schizophrenia is low reliability. Chinox et al. And two psychiatrists independently diagnosed 100 patients using both DSM and ICD criteria. The inter-rater reliability was poor. One psychiatrist diagnosed 26 patients with schizophrenia using DSM and 44 using ICD. Whereas the second psychiatrist diagnosed 13 patients with DSM and 24 with ICD. This inconsistency between mental health professionals and the different classification systems is a limitation of the diagnosis. It also highlights that the diagnosis is not objective, but rather it is subjective, and there are implications to this, as it means people may be misdiagnosed and may not receive treatment. This reduces the appropriateness of the schizophrenia diagnosis. A second issue in the diagnosis of schizophrenia is whether the condition actually exists or whether it is distinct from other forms of mental disorders. A validity problem is that there is considerable overlap with other conditions such as bipolar disorder. People with bipolar disorder also experience delusions and hallucinations. Therefore, diagnosing a person with schizophrenia may lead to a faulty diagnosis because schizophrenia shares these key symptoms with bipolar disorder. Another problem is that two or more conditions could co-occur. This is called comorbidity. These include substance abuse and symptoms of depression. It may fall into question whether they are actually a single condition. Researchers concluded that around half of patients with a diagnosis of schizophrenia also have a diagnosis of depression or substance abuse. In terms of classification, if very severe depression looks like schizophrenia, vice versa, it may be they are a single condition. This confusing picture is a limitation and reduces the validity of schizophrenia diagnosis. It also suggests that there is issues with the classification and diagnosis of schizophrenia due to comorbidity issues. A strength is that there is real-life application. So, a real-life application that has risen from researching the classification and diagnosis of schizophrenia by introducing a schizophrenia spectrum which could eliminate the problem of validity. This means that instead of looking at the presence of symptoms, the psychiatrist could focus on the severity of the symptoms that the patient is experiencing. This would increase the accuracy of diagnosis and the effectiveness of treatments offered.